Good afternoon, friends and community risk reduction partners. Welcome to this morning's gathering, our annual meeting with all these special folks here. Uh, all these state fire marshals, people from an NFPA. Welcome. Glad you can come and partake in our discussion that we're going to have this morning. I'd like to introduce myself. My name's David Deskis, and I've been in the fire service for nearly 30 years. I first started my fire career as a volunteer shortly after graduating high school, and then I decided to enter the United States Air Force, which I began a career in multiple fields. Originally was aircraft mechanic, in-flight refueler, and then I got kind of a niche with the fire service, so I joined the fire protection field, where I progressed through my career field as a station captain, chief of training, chief of fire prevention, operations chief, and I served as an interim fire chief for a little bit while one of the permanent fire chiefs had to step aside for a little bit after a personal problem. After retiring from the Air Force, I pursued a career in the fire marshal field, where I served as a fire marshal slash emergency manager, which I kind of had both roles for multiple agencies. Worked part-time, full-time with some of those agencies. And I have extensive experience in multiple facets of federal government, state government, tribal government even, and obviously DOD. And throughout these years, I had the opportunity to work with some great people and learn from good mentors and professional practices. During these years, I've been exposed to many fire investigations and quite a few major events throughout my career, which kind of seasoned me into the position where I'm at now. Currently, I serve with the Thompsonville Fire Department, Thompsonville Fire District Number 2, in Enfield, Connecticut. We're on the border of Connecticut and Massachusetts, right up. If you follow the Connecticut River, you can find me right there on the corner. That's where we're at. I got a bachelor's in fire administration. I have associates in fire technology, AAAI, CFI fire investigator, EFO, and certified emergency manager for the state of Connecticut. I also I'm involved with the state of Connecticut emergency coordinators, which they're a communication unit that goes out during major incidents. So enough with me. Let's get started with this, and we're going to cover community risk reduction. And I'm going to open this up with a statement. So what have you done for your community rather than what your community has done for you? So kind of think about that a little bit. Our public always are bringing stuff to, agencies like food and stuff. But if you really look at the big picture, what have we contributed to the public with providing good emergency services and community risk reduction? That's the big thing right now. So we're going to cover that a little bit, and hope you have a little bit better understanding of community risk reduction programs. So let's start, okay? The goal of this presentation will be to bring attention to the challenges and opportunities that will be faced by the community risk reduction, CRR, going into the future. It's a big thing right now that most agencies are looking at, and it's actually very important for our existence. And if you're in a fire marshal's office, community office, the more we do, the more we justify ourselves. So there's 6 steps, a 6-step process that needs to be conducted when you begin your community risk reduction program. The first is to conduct a community risk analysis, and you're going to identify its risks. So you want to know what risks you got in your community. You could be a large community, you might be a small community. So we're going to prioritize those from low, moderate, high, and special risks. You may ask yourself, what's a special risk? If you got airports or manufacturing businesses that have special chemicals, those are the special risks that you might want to look at. Or large healthcare buildings that have a lot of patients that may possess a problem if there's ever an issue there. We're going to number 2. We're going to prioritize and develop community partnerships. We're going to do that with our local EMS department, our local state and federal police agencies, if you work with those, your fire departments, local fire departments, social services, city council, or if you're not a city, you can town councils, and community special services. The third, we're going to create and develop intervention strategies and tactics. What's needed, who needs help, how to help, and how to implement the plan. So, there's a lot already starting just in the first 3 steps. So you're going to need some help. You're going to need some people to help you drive this program if you want it to be positive and work out for you. So make sure you have people that are dedicated that really want to help. 4 is going to be prepare a plan. So you have to designate a plan, have the necessary help, and have the necessary resources, which I went with the manpower. And what is your plan? I mean, what do you want to do? Do you want to teach CPR? Fire extinguisher classes, car seat classes? You have to decide when you make your plan what you want to do to contribute to your program. And then you're implement a strategy. We really don't have to really go into that. Once you have your plan ready to go, that's kind of going into your strategy, how you're going to spearhead it with the people that are going to be working with you. And then you're going to elevate your results. Has risk been lessened? Has the quality of life improved? And is there less risks as before? So there's different ways to gauge those. And when we move past it a little bit further down into PowerPoint, you'll get to understand what I'm talking about right there. Okay, the next thing is the 5 E's of community risk reduction. So there's five little circles or 5 little blocks that you might want to use. We'll start with enforcement. Could passing, strengthening, or enforcing laws or rules impact the risk? Well, once you start enforcing rules on people, sometimes they'll have a little bit of a pushback. And that's where education comes in. You kind of educate whoever you're enforcing those rules with and explain to them why you're doing it. And it's not intentionally just going after somebody. You're just trying to help them. You're going to education. Would alter the public's knowledge, attitudes, and awareness related to risks and impact of behaviors. That's another thing. You have to educate people to kind of coordinate what you want them to do. So education is a very, very key part of the 5 E's. And then economic incentive. Could economic incentives or penalties encourage safe behaviors? Well, yeah, like a lot of insurance companies, if you're a good driver and you don't get no speeding tickets, well, they cut your rates a little bit. If you don't have any issues at your home for claims or anything, your rates go down. If you go the other direction, you're a bad driver, you're kind of careless, with things, obviously there will be penalties. And that's how this program will kind of mitigate itself, when you're driving the education to the people. If you do things right, there'll be some more rewards for themselves and the community and just everyone in whole. Emergency response. Could adding or enhancing emergency service improve community safety? That's a no-brainer to me. I think it is. Adding and enhanced emergency management or emergency resources and services anywhere is going to help. More people, the better. You know, I know nowadays people do more with less, but the more people you have, it will enhance your response, your response posture, and also help you later on down the road, and hopefully get some more people to even help you. In engineering, are there technology solutions such as products or materials that could help reduce risk? Well, I think probably the best analogy is police officers need to have the best equipment for being in the field for the dangerous job they do. Firefighters need to have the best equipment to fight fires and do vehicle extrications or hazmat calls. And then, of course, EMS. You know, that's probably almost 95% of a lot of the calls nowadays. And you got to protect yourself because there's many different sicknesses out there, and then also people are using all different type of drugs, which exposes the responders to hazardous situations that could make them ill further on down in the past. So you got to have some engineering equipment to kind of help you out. Next thing we're going to go over is what do we need to do? We want to identify the department's community risks. So you got to look at your community and say, hey, what risks do we have in our community? What's going to make it worthwhile to do this program? You know, if you got something that's not too much of a risk, there's really no worth in doing the program. But you really have to take a good look, do your homework to see where you sit. So review of historical performance, current capabilities, critical tasking, risk scales, the demand of the community, expectations of the community, and have helped facilitate the establishment of performance measure and performance objective standards. So you want to have performance standards to make this thing work here. You wanna have some kind of benchmark to work towards. The staff shall develop metrics that are specific and very measurable, not making it too difficult for your people. Attainable, you want to make it so there is light at the end of the tunnel. And relevant, you want the information to be kind of current. You don't want to use old information. And you want to set a benchmark on time. Do you want to do it 6 months or 12 months, 36 months? You know, that's up to you. That's totally on the team's part on how they want to do this. And then taking into account and evaluate the needs based on growth. Is your city growing? Is there more fires? You know, during fires, do you have flashovers? What's your EMS response needs? Special services needs? You know, you name it. You can put it in there, whatever you need. You want to look at your response times, on-scene operations, problem solving, critical tasks. Department staff should be able to determine an effective response force benchmark for the community. So you want to set a benchmark so you can do this and make it worth doing. In this next slide, this is an example of my community. The first slide on the left here, the building that's on fire, it's a 4-story mill. That fire was started by some homeless people that were using some illegal narcotics, and they were just trying to stay warm, you know, in the middle of winter. And here you go, you got a 4-story mill completely in flames, and eventually had to be tear down. The middle photo here is Aldi supermarket. A disgruntled employee got mad at the employees that he was working with, and he lit the dumpster on fire. The reason why the dumpster was on fire, because he dumped all the trash back there, and there was a very poor housekeeping, which contributed to that fire. And then always to the right-hand side of the slide, it's this room full of all kinds of different materials. That is a hoarding situation, and you know, we all know hoarding reflects on mental illness, makes it difficult for our first responders to go in and do what we need to do. And these people need help. These people aren't just dirty people. There's something going on, and that's just something that we'd have to look at when we're doing a risk analysis of that type of community function that we're going to be dealing with. Experience, knowledge, and example. While reviewing my department, that's why I used my department data reports from the last 3 years, I had noticed there was an increase in our poor section of the city, which were mainly 3 or 4 family units. And they're Bloom-style construction homes, old mill homes, which once they start on fire, they get going. I compared this section of the city from our less oppressed section of the city and noticed a trend that created a lesser risk to a more higher risk element. Many of the high risk areas were transient occupants, which were not permanent residents. Many of the people in the high risk areas were all less educated because they didn't finish school, and there was a high dropout rate with those, and they were mostly drug dependent. That led to the problem that we had in that section of the city. You might ask, how did we get to this point? Well, when we look at what we're going to do, we're going to look at our community, what we're going to serve. So this top block here gives me a percentage of how many Caucasians live in our city, how many Black, Hispanics, Asian, American Indians. So we just kind of gauge that. So, for example, if we had a large amount of Hispanic population in our city, we would make sure that whoever we put on our community risk reduction team would be able to speak Spanish or Mexican, just to be able to coordinate and educate these people, because I wouldn't know how to speak to them because I don't speak Spanish or Mexican. So that would be a huge help for your organization. You also use your city data. I know this is kind of old data. It's the latest I got was 2015, but you can gauge your level of crime throughout the years from 2002 to 2018, and that could contribute to trying to solve some of the problems that you have. Develop a community partnership. While reviewing our department's data collection, review the busiest response area and the most financially affected areas with which your department responds to on a regular basis. The data collected will be data collected from the latest U.S. Census and demographics collected through the latest government polls. The department's CRR division will canvass the areas affected in an orderly fashion, which will go door to door to hand out preventive measures, information packets to educate the public on issues, which will be addressed by our department and our partners that we have helping us conduct our program. So going to the door and talking with people it's a good thing. And the next, how are you going to implement this? Implementing the CRR strategy. You want to work with our community partners to implement the plan. Town managers are some people you can go to, mayors, social services, health departments, etc. It's a large number of people that you can try to get on your team to help you out. 2, working close with our local education department. We want to have a good relationship with the school superintendent, teacher staff, educational partners, paras, all those people that work, right down to the janitors, school resources officers. We want to talk with those people and get them involved. Working with and planning with our business partners. As we know, everything costs money these days, so local stores, banks, and restaurants may have the capability of giving you some funding, through donations and stuff like that, which is a huge help for a program if you can't afford a program. So those are things that you can go for. Securing grants to fund the programs. Very good things to do, but I'll tell you what, the competition to get those grants are very difficult. You got to have good grant writers, and you got to really look at what you want to do for your CRR program, because they look at certain things, and you got to be very careful. So find someone that really knows what they're doing with those to help you out. And 5, secure buy-in and support from area politicians. That could be from your local, federal, senators, and then the political staff, the people that help them out. You get to know those people, then they talk to their bosses, and then they may be able to help you. And a lot have. They're very helpful at times. Develop a community support staff to help with the program. And that would be to help with homeless shelters, homeless support staff, food kitchens, etc. Future of the community risk reduction. Currently, CRR in most agencies has done a good job, but we can do much better, I think. Over time, we'll learn more and more about it, and we'll be better. And how are we going to do better for the future? So we got to plan it out for our future also. Better education and training. Take as much classes as you can to get educated in the program, so you make the program better. Leave it better than it was before you got there. Statistics are the key to our success. So you got to keep track of everything that you're doing to see if there's improvements. You keep track and see something's going backwards, then you're going to have to do something different. You can use different agencies to get these. You can MFERS, NFPA, Public Health Department, Police Department records, Fire Marshal records. You can even go with the American Red Cross. They have data and also a lot of information that could be very helpful for you. And we come down to the culture. What is culture to you, and what do you think the culture in the community risk reduction is? Is it sufficient currently? When we go to work is our employees completely engaged in the prevention of property loss and life safety? Many would say yes, and many would say no, depending on who you asked. Many of our age gaps would agree that each group does well, and then say the opposites in regards we're not doing a good job, the other group. Culture is a responsibility, and we owe it to the organization to ensure whatever is being pushed in the community risk subject to be carefully addressed to your people, and to ensure the importance of the subject is presented to them. It doesn't come down to age, it comes down to working as a team all together. We need to separate our cultural views and learn how to work together to make our values viable. We need to let our people know the importance of community risk reduction education, and how it keeps to be passed on to the communities to educate them on the importance of them. So we got to let the public know that what we're teaching is very, very important. How do we provide information to the community risk reduction? In this current age, there is no excuses on how to reach out to our communities with social media sources. There are current multiple social media avenues for organizations to use to address the important information related to things such as smoke detectors, or I've just put smoke detectors in there just to kind of, that's what we're pushing. So what we're going to do, we're going to put that on Facebook, Fire Department Facebook, put out, hey, we're going to be giving out free fire smoke detectors, or we'll install them for you. Put on Instagram. The new X was formerly Twitter. That's a good one to go on. State websites. See if state websites will put your information on there. Municipal websites. I think every municipality should have a website now these days, unless they're severely underfunded. And then FEMA is a good avenue to look at. Local organizations, businesses might put something on there for them. And then push out in the schools and churches, where large gatherings are. You could really make a difference pushing into, little areas like that. Well, I shouldn't say little, but large. But and how do we train our people, and where? Training begins the first day an individual walks right into the firehouse, fire marshal's office, police station, EMS area, wherever. And hopefully there is a good senior leadership there to help the person with a healthy, prosperous career in community risk reduction. Many organizations provide information in the subject of community risk reduction And these could be found in your local fire schools, local fire departments, fire marshal offices, FEMA websites, www.fema.gov, National Fire Academy. There's a website for that too. Private training academies, and there's all kinds of private ones around. American Red Cross and OSHA. The above list organizations are just a few which could provide the public with high quality education and risk reduction. And then the leadership, it will have more responsibility with people and will be required to do more with less, though there will be more subjects added in the future. Leadership will be required to ensure their people are properly trained and properly community risk reduction is the subject is being presented to the public they serve. Leadership will also require a budget for ever-changing financials of the community and learn how to create and ensure their services are provided fairly and equity through the community. And community risk reduction costs will keep increasing and will be budgeted. You have to budget properly to ensure the safety of everyone involved. So we come to the conclusion. I want to thank everyone today for coming out. While reviewing the material presented, the group should have a better understanding of the importance of community risk reduction, conducting a 6-step process along with the required needs of your community. You can now have the better understanding of what is involved in the planning and implementing the process. Planning and implementing is everyone's job when it involves keeping ourselves and the community members safe. Thank you for your time, and I hope the information presented to you is useful for the group. Have a great day. Thank you.